Hi sir, good morning. I am Dr. Enokong Jr. from Berian State University and I am your student classmate today. So the purpose of this interview sir is to know your health history. And with this, it will benefits for you to know the underlying problem that you have. And also, this interview will be confidential. So by the way, what language do you prefer to use?
So I can understand English and I can answer also in English and I can also understand Bisaya and Waray. So okay na sa ako po kung mag-Bisaya ta, mag-Waray ta, or mag-English ta. Okay na sa akong po. Ikaw na bahala. Sir, kung sa imo ganahan gamiton na mag-Waray para sa ako.
Okay, sige. So first, I would like to have your biographical data.
Okay.
So can I have your full name please?
So my name is Galvin Kendall Naparis Potasio.
How about your age, sir?
I'm 20 years old.
Okay. Male, and what's your marital status?
I'm single, sir.
Okay. How about your address?
Wait. My address right now is I'm living in Barangay Canila, Biliran.
Okay. If you don't mind, sir, may I have your mobile number?
Okay, so my contact number is 0908 733 1243.
Okay. How about your birthplace?
Okay, my birthplace is in Palo, Leyte.
Okay. The birthday?
My birthday is in November 8, 2001.
Okay. How about your religion?
I'm Roman Catholic probably.
Okay. May I ask about your highest educational attainment?
I'm still an undergrad and I'm in my second year right now.
Okay, so I repeat the data that I've gotten from you, sir, and please correct me if I'm wrong. So, your name is Godwin Kendall and Potasio.
Wait tayo sir, pakilakasan yung boses po kasi may ano.
Okay, so your name is Godwin Kendall Napoles Potasio.
Yes po.
20 years old.
Yes po.
Male, and your marital status is single.
Opo.
Your address is Canila, Biliran.
Yes po. Barangay Canila, Biliran.
Okay, Barangay Canila, Biliran. Okay. Your mobile number is 0908
Yes.
733 1243.
Yes po.
Okay, your birth date is on November 8, 2001.
Yes.
How about your birthplace is Palo, Leyte,
Yes po. Palalay.
and your religion is Roman Catholic,
Uh-huh.
and your highest educational attainment is undergraduate and a second year student.
Yes. Second year college student.
Okay. So, may I ask about what is your purpose or reason for seeking healthcare?
Also, my purpose or my reason for coming here today is that because last week I've experienced pain on my while I'm urinating. So, mautong sir nga niyani ko karon para masabtan ba jud kung what underlying problem. So, what is my problem talaga since I experience pain while I'm urinating.
Okay. So how about what is your recent illness you have?
Oh, well, I was diagnosed with UTI hadton last January. Last January pa noon to. Diagnosed ko with UTI.
So may I ask about what particular area do you feel the pain?
Particular area, so sa cancer siya, lower part of my stomach dito sa may gani sa may bladder. Masakit na siya niya sa likod sa akong back. Ay, sa likod sa akong back, sorry sir. Sa likod, lower part sa akong back, masakit sa siya.
So how's the pain, sir? Mura ba siya di-stop or mura ba siya ipumot or isang
Well, ang pain kasi niya is not like ipumot siya. Dili siya ipumot. Kaya di naman siya palang pumot dyan. Ang iyang pain kasi is like backstabbing back.
Okay.
Kana ang iyang pain. Yung pain is mura jud siya backstabbing.
Okay. You mentioned that it's very painful. So if paparate kita in pain from 1 ang less painful to 10 ang very painful. So, which, if I rate you 1 to 10,
Okay, sir.
kasi mo, hain man ang pinaka,
pinaka-answer, like kung asa siya dapit,
oh yes.
painful, sige sir. So, if I'm going to rate it from 1 to 10, 10 being the most painful and 1 being the less painful, in tulong mo pa man sir is, sa tingin ko sir, alas kasi 7, kay, really, it is not that painful, pero it's not also less painful. So, marang 7 jud siya sir.
Okay. Do you have any medication or nag-take ka ba ng mga medicine or do you use only herbal medicine?
Okay, well, I was diagnosed with April, right, sir? So, like, they give me a medicine, but I didn't take the medicine since I believe that I can be cured using the herbal.
Okay.
So, yun, I just use herbal medicine, like, init ko og dahon sa malunggay, niya, dahon sa sabana,
Okay, so you're using organic medication.
herbal medication.
Herbal
Yes, sir.
medication, I mean. So I have a few questions here for you and about your history and I hope it's okay for you.
History of unsa po, sir?
Past illnesses.
Sige, sir.
Okay. About your immunization, sir. Do you have any immunization in your past history?
Yes sir, katong hapa vaccine kay need man siya sa among course.
Okay, pa. So, may I ask about your childhood illnesses you have, like, do you have any chickenpox and etc.?
Well, I don't have I mean I don't have the whole. No, nandiyan ko chicken pox dati when I was in elementary. But childhood illness man na, di ba sir?
Yes.
Okay. Tapos nagkamalasad ko inborn astigmatism na na-trigger when I was on daycare.
Okay. Does it hinder your works?
Well, di man ingon niya i-hinder pero like I was not allowed to go outside when I was having chicken pox. Siyempre ganun makatapon man dahil ako nung siya sir.
Oh yeah.
Niya katong astigmatism ko lang di ko maka-engage ko og mga physical activities since I have classes.
Okay.
Niya, ingon sa akong parents na dili daw ko mag-iho kay basig magpa ang glasses or mga
Alright. Okay. How about chronic illnesses? Do you have any, sir, in the past, Nina?
wala man doon sir.
Okay. So how about do you have any accident or injury?
Wala sir.
Okay. And how about hospitalization? Do you have any?
Well, kato lang sir, ay dili man siya hospitalization kay wala man ko ka-admit. Pero wala gito sir, ito nagpa-katok sa hospital for check-up sa BTI man to.
Okay. So napa-check up ka?
Oh, pero hospitalization kung referring kung na-admit ba
Oo.
wala man yan. So,
Wala pa. So ano naman pa-check up sa UTI mo, no? So do you have any diagnostic procedure?
like what man sir?
Like do you undergo a
surgery?
any diagnostic procedure, sir? Like na-diagnose ka na ba ang mga lahi nga sakit katong imong past yan
Wala naman sir.
So okay, wala. Do you have any diagnostic sa sir nga makapatrigger sa imong UTI karon?
Well, wala ko sir kabaro sir, pero ambot sir baya, di ako maano.
Okay.
Bragwa man po.
So, about the surgery, do you have a surgical procedure, sir?
Wala sir.
Okay, wala, sir.
Wala pa man ko kahang tinang matikang wa pa man ko na operation.
Okay, sige. So, how about allergies? Do you have any allergies in the past health history?
Pardon sir, kay mo lang watch ko pa patikinan mo po.
Okay. Do you have
Ilang ko na since sir yung gamit.
do you have any past history about allergies?
Wala. Wala man ko yung allergy noon.
Okay. How about medication? Do you have any medication in your past?
Wala sir.
Okay.
First lang ko herbal. like malugay jud kay mao man lang ko pinaka makakuan ay dili gyapon ni lagundi lagundi para sa upo kay sometimes di ubo man sad ko.
Does using herbal medicine help you to lessen the pain you have right now?
Oo sir, oo. Usahay makapugo pero usahay kung sakit jud siya sir, sakit jud siya sir.
Okay. So, about travel places, so do you have any in your past that do you have any past illnesses while traveling places?
Like for example, like kung kumanto ko sa ibang lugar, naka-acquire pa ko ng sakit.
Oh, yeah.
Wala man noon, pero last travel na ko, it was on 2019 ato ko sa Korea. Vacation naman ko siya. Wala man noon ko ka-acquire dito sa sakit.
Okay. That's good. So, about your family history, sir, is it okay nga mo ask ka about your family history?
Yes sir, sige lang.
Okay. Do you have grandparents, right, sir?
Patay na ako mga grandparents, pero I still remember how they died or kung sa'y kamatian nila.
So, can you tell me about more about your family history, why you get the medicine you have right now?
Okay, sige sir. So, my grandparents on my mother's side, sila lola nga sa aking mother's side. Si lolo, yung kamatian was stroke. While si lola, yung kamatian is diabetes tapos high blood.
Okay.
Tapos, sa akong father's side, wala man noon sila sakit. Namatay na sila old age. Kay si lolo, mga 74 na to, namatay. Tapos si lola, mga 72.
Okay.
Si lola nga to sa mother's side na ko, mga 60 noon to siya. At si lola, mga 64.
Okay. How about their children?
Sa mother's side?
In your mother's side.
So, balik, sila mami is 6 sila nga magburog to.
Okay.
Yeah, they have adaptive, dapat fine lang sila, they have adaptive sister man. So, unahan ako na lang akong adaptive tita. So, ang akong adaptive tita was like, wala man siya sakit. Paano siya karon 47. Kaya still alive and well man siya. Yeah. Ang akong titos like mga 60 plus naman to sila. I mean, agad mga 43 ang puto nila mami. Mga 43 or 45 na to siya. Ang mga 60 plus, ang usa ko katito may sakit na prostate cancer. Ang usa po is high blood pressure, and the other one is high blood pressure. Tapos si tito nga 45, high blood gihapon. In line man kay na mami ang high blood. Si mami sad is na siya ay diabetes, high blood. Tapos nag-ingon to si mami sa ako dati nga katong nagburod ako no siya nagkamedas ng UTI.
Okay. So how about your father's side?
Okay, sa father's side naman, napugto nila daddy. Sila dito kita, limaman lang sila, kuha man sila yung ampon niya. So, again, wala sila yung ampon na bugto. So, si tita ko, pero sa Madeira babae, si tita is 60 plus na gihapon.
Okay.
Wala siya yung sakit. Alive and well man siya. I mean, healthy man siya. Pero, syempre, lagas naman yun. Tapos, ang tulo ko katito sa father side na ko, ang tulo ko katito, ang usa na ay high blood gihapon.
Okay.
Ang usa, medyo na stroke. Tapos, ang usa patay na. Kay alcoholic man.
Okay.
So, bali, baga, kini-failure na ito yan, kapat yan. Tapos, si daddy karon wala man no si daddy sakit, pero in the past, nagpangutan na sa ito kay daddy na siya ba, kami na po siya UTI. Ngayon siya, na-upload daw sa siya.
Okay. So, how about your sisters or brothers?
Kung siblings?
Oh, yes.
Sir, kung noon, sir, sa akong mga ate, kuya, ako man ang puto ba na mo? So, ang akong tulo ka ate, usan ako ka ate, Ang usa na ko kaate is wala man no siya sakit.
Okay.
Ang usa 47 na. Ay, 47, I mean 37.
Okay.
Wala sa siya sakit, pero nagbobog siya sa iyang anak, yung ikadwa nga anak, nagka-high blood siya.
Okay.
Niya, ang ako sa kaate, mga 25.
Mm-hmm.
Ako sa 22 to sir. Ako sa is 25 na pwede yung typhoid fever. Tapos sa akong kuya, wala pang sakit, 34 naman sa karon. Ang akong usa ka kuya noon, 33, namatay siya at the age of 33, kung siya hapon alcoholic, hapon siya.
Okay.
Oo. Noto. Tapos, ako, I'm 20 years old na ako karon UTI daw. Oh, yan daw. Kita tayo. Last January. Diagnosed kong UTI. So,
Okay.
noto siya. Noto ang akong history. Family history.
Okay, thank you for the information, for your family health history. So, now that you acquire this kind of illnesses, how's your health perception before and during the illness you have acquired?
Okay, like, I was encouraged naman, di ba, karon. So, before ko nagkamay-anda nga illness, before I acquired this illness, like, ang akong health perception is I was very healthy. Since I can do my things.
Okay.
Like, I can do exercise, do
Yes.
things that I want.
Okay.
So, yeah, I prefer calling myself as a healthy person, kaya I can do whatever I want, man. The things that I like.
Okay.
So, that's my health perception.
So, how about during?
So during this, or having this illness right now,
Okay.
like nalimitahan ang akong pag-exercise, ang akong mga tawakon is nalimitahan. So murag, ang ako na-perceive is, I'm still healthy, pero less healthy na. Hindi na siya
Okay.
perfectly healthy.
Not the same before.
Yes, not the same as before.
Okay. How about your nutrition or metabolic intake? Does it affect your nutrition while acquiring these illnesses before, then after, and during?
Yeah. Before having this illness, like, I will admit it honestly that before having this illness, my nutritional intake was very bad.
Oh,
Since I eat a lot of salty foods, then I drink a lot of soft drinks and junk foods. I really love eating junk foods, probably. But
Yes.
wait. Before pa then, I don't like eating vegetables. Like, I decline on eating vegetables, especially
Yeah.
salads and stuffs like that. And
Mhm.
I don't like it. So, yun. I don't eat like veggies. So, after or having this illness, like, I'm going to eat healthy foods na, di ba? Kasi yun nga yung sabi nila. Yun nga, uminom na ako ng mga tsaa para daw makalasing sa pain. Kaya, I eat less from salty foods and I don't even drink soft drinks na. Dapat lang water therapy, water all. Tapos, ayun, like, I still decline on eating vegetables, so yeah, I don't still eat veggies.
Okay. So do you have any nutritional plan, diet,
Probably no, I don't do any
proper diet? Do you have one?
no, I don't have one.
So do you have a monthly checkup about that? Or
Probably no, I don't do monthly checkup. I just do checkups when I have problem na po.
do you have a nutritionist that help you to have your
Wala.
nutrition intake?
Wala.
Okay. So, how about the elimination you have doing right now? Before you acquire the illness you have and during the illness, how's your elimination?
So, well, before having the illness, my elimination? Yes, my elimination was perfectly fine kasi I don't feel any pain naman. Pero, having this, or during this time, having this illness, it is very, very, very difficult to eliminate. Especially, di ba pag you're going to eliminate, you're going to pee naman talaga.
Oh, yes.
So, yeah, you will, my God, you will feel the pain.
Okay. How about does there's a changes of color or smell of urination
well,
before and after?
Sige, sir. Okay. So, before, sir, is, before noon, when I was like urinating, elimination of my urine,
Okay.
wala man siya wala man siya changes of color, which is, it's amber color. So, meaning, normal man na diba, sir? Ang amber ang color niya.
Yes, normal.
Pero during this time, when I was eliminating, or I was peeing, urinating, well, naa siya color jud nga dark yellow. Niya, napo siya smell. Tapos napo mga bubbles.
Okay. So this changes of your elimination before and during the acquired.
Oo.
So okay. So how's your activity and exercise before and during you acquired the illnesses you have right now, sir?
Okay, sir. So, before I acquired this illness, before ko nakuha niya na illness is, ano ko na-exercise, sir, same as my, health perception. I was healthy, so I can exercise more.
Okay.
Wala hindrance sa akong pag-exercise. But right now, having this, last na ako na-exercise kay, I cannot go to the gym since, murag pag muadto ko, inom kong tubig niya, kaihion ko niya, di nakabalik pag-exercise kay, masakit naman siya, sumuuli na lang dito. So, I prefer at home na lang dito talaga.
Okay. It sounds irritating or something distracting.
It's distracting ka niya. It is irritating also because you could feel the pain.
Yeah. Okay. About your sleep and rest pattern, how does your illnesses, how about your sleep rest pattern? How does it affect your sleep rest pattern when acquiring the illness you have right now, sir? Like before and during the illness you acquired, how's your sleep and rest pattern?
Okay, so my sleeping and rest pattern before having this illness was, it's good naman kasi I sleep at 9 p.m. I sleep at 9 p.m. and wake up at
Okay.
6 a.m. to do my chores kay my kasinan ko. So, it was nice and it's normal. However, having this illness right now, like, na-change good talaga akong sleeping pattern niya, akong rest. Kay, like, matulog 9 p.m. sa gabi niya mamata ko mga alas 12 kay mangihi ko.
Okay.
Magmata ko alas 12 nga mahihi ko niya, masakit man na siya. So, pagbalik na mo sa hida, di patuog kay masakit pa siya. So, mamtad ko alauna, alas 2 niya, pag makatug na sa alas 2, umata ko, imbis nga akong mata is 6 a.m. tungkol kaya makamata ko sa akong alarm, mauna pa ko sa pagmata sa akong alarm, kaya mo ikot na sa 2. Nga, di na ko kabalik pag 2, kaya mo sakit na sa siya. So, niya, kaya maalas 6 naman. So, di na ko mabalik pag 2. Gius na lang ko kaya may klase pa man ko.
Okay. So, how about your cognitive or perceptual? How it does affect your cognitive when acquiring the illness you have before and during your illness? So, if you say cognitive, does it affect your learning ability, hearing ability, or vision?
Mauna sir ang mga cognitive.
Yes.
So, unsa to sir ang cognitive?
About your learning ability. Does it affect your learning ability, your vision, and your hearing?
Sir. So, well, before having this illness,
Okay.
akong cognitive ability and akong learning skills, ang akong verbal thinking or ang akong focus is I'm very good at it naman kay wala may makadistract sa ako. Niya, it's fine man kay nababaruman ko dayon murag okay man siya sa akong cognitive skills, sa akong cognitive abilities. Pero during this time, having this illness, murag every time na mo urinate yun ko sir, murag after na ako pag-urinate, I can feel the pain man. Di good after, murag kung onset good, pag mag-urinate ko, kung sakit dyan siya niya, putog na kauman ako pag-ihi. Niya, mga to sir, murag maka-distract siya sa akong focus ba. So, sa akong learning ability, so maka-affect good siya kay di naman kung maka-focus sa akong gibubuhat kay anak ko naman na pag pinamitian is ang kasakit na lang sa akong gibati. So mao na nga dili ko di gid siya siguro nga maka-affect good siya, pero maka-affect good siya kay wala siya focus.
Okay, does it change your personality or whole personality?
Wala man noon, pero dati, before ako magkamalidaan, hindi naman ko madali masuko. Like, di man ko masuko pag may pangutan na yung anay anak. Pero right now kasi pag, like, kung masakit na siya, you're irritated na sa imong paligid. Like, mawala ka na galing focus niya pag may nangutan ka pa. Murag, madali ka mas minaanak eh. You can feel the pain niya, may masamok pa sa imo. Nga imong ipinamatian, masakit na galing niya, may masamok pa sa imo. So, I feel irritated somehow.
Okay. How about your role of relationship? Does it affect your relationship while acquiring this knowledge before and during the illness?
Oh, well, before sure, wala tayong problema. We're going out for a date. Well, we can eat outside at a restaurant like that. Pero right now kasi, the relationship with my special someone, then sa mga friends na ako, I cannot go out for any of the following, like dates or gathering. Kaya, I rather choose stay at home, stay in bed, kay kung masakit na jud siya, masakit jud siya. So, mao man lang na naka-affect kay dili na ko kagawas, good kaayo kay tungod sa sakit, sa pain.
How about your value of belief or value of beliefs? Like, mga gusto niyong buhaton, does it affect your value belief before and during the illness you have acquired? Does it
Well, same man nagyapon before and during and akong value belief, still the same, wala may nang pagkakita.
Okay. So, about your self-perception, does it affect your self-perception before or during the illness you have acquired?
Well, yes. Kaya dati, I can feel nga I'm very healthy. Tapos karon dili na. So, murag naglasan na ako confident and akong self-esteem.
Okay.
So, before, so I can feel confident. I have to know. Pero during this time, murag naglasan dyan siya.
Does it kanang lessen your hope or have you lost your hope?
No, dili man no, sure. I still hope. I still have my hopes na matambal mo ko ani.
Okay. So, about your coping mechanism, how do you cope your stress?
Well, I have a negative coping mechanism, sir. Especially kay, like, if ma-stress na jud ko, sir, mukhaan jud ko. Especially like junk foods talaga, sir. Kay, ganahan man jud ko, ana. Niya, mukhaan ko junk foods, niya, mukhaan ko mo inom ko soft drinks. Kaya, mau na akong coping mechanism. When I'm stressed, mukhaan jud ko.
Okay. How about during the
Pero during this
the
time,
illness?
bawal man na siya. So, my coping mechanism is my special person.
Okay.
So,
So,
uya mga akong yun na nagko-cope sa ako.
okay, that's sweet. So, how about does your food it does limit your food intake? And you have said before that
Oo.
you like to eat more. So,
Sa food intake, sure, like, same as ang akong question dito sa my,
nutritional intake.
yung nutrition intake, sure, kaya di ba nahinuman ko nga like, junk foods.
Okay.
So, sa food intake talaga, sir, naglasan talaga.
Okay.
Kaya kung dati, unhealthy diet, still eat a lot of junk foods talaga, kaya mga fast foods, kamukuanan niya, soft drinks, good sir, especially Coke,
yes.
just good sir. Pero right now, my food intake is naglasan niya po siya, I lost appetite, kaya pag-lost yun akong appetite sir, kung vegetables lang ano sa lamisa, so, pero, kidding aside sir, naglasan yun ang akong appetite, so murag din ko kakaunog tamo, kay pag musakit na yun siya, I prefer on bed na lang talaga.
Okay. Does it change your physical body, physical appearance?
Kumasa daw ko ko sir.
Okay.
Oo lang. So before, murag tambok pa, pero karon ako nun, gasa daw ko na.
Okay. So, how about your sexuality or reproductive? Does this illness you have acquired change a lot of your sexuality before and during the illness you have acquired?
Sa sexual patterns,
Yes.
sexual and
Before.
reproductive patterns, sir. So, before nagamay na ko ani is, well, I can satisfy the person that I like. I love my special person. Satisfy na ko siya. Pero, right now, syempre kay, during this illness, I lesson some activities man kay dili talaga ko kuan ba dili ko kapugong sa sakit jud niya. So mao to sir, mao to ang changes niya. sa akong reproductive pattern sir kay mura pang ihijud ko sa gadget siya ang
Okay.
akong kuan.
Your vibratory.
Oh, yung akong ari ko sir masakit pa sir.
So, now you have already know your changes of your activities and other doings na imong gibubuhat before and during your acquiring the MSU hub. So, you must be responsible in having your time, responsible in eating foods. You must also make to the hospital and have a proper checkup with your doctor. And you need also to have a proper diet, and you must have a food, water intake like 8 glasses a day to remove all the toxins and other substances that you have in your body. So you need to be more maingat, and you must listen drinking soft drinks and eating salty foods, and one thing you need also to eat vegetables to have a healthy body. Thank you, sir, for giving me this information. I know and you will already know that this interview will be kept confidential. Thank you, sir, and good morning.
Yes, sir. Thank you.